Welcome back, guys. Today we are going to learn a very important topic in hematology, which is hemoglobinopathies. Make a good note of this, it helps you in your second year and even in entrance exams. So don't miss out these topics. Make a good heading, not good heading, make a good notes, right? Hemoglobinopathies. Okay, chalo, we'll start. So we have qualitative, then quantitative. Okay, we have qualitative and quantitative. So in qualitative we see sickle cell anemia. We'll discuss this in detail. Make a note of it. Okay, we will say it as SCA. Then we have quantitative, we have thalassemia. I hope you heard these words, right? In qualitative we learn about sickle cell anemia. In quantitative we will learn about thalassemia. Okay, so in this video we will learn mainly about sickle cell anemia. Make a heading, sickle cell anemia. Yeah, okay, we'll start. Yeah, from I guess from 10th standard this is not leaving us behind, right? Still we are running around the sickle cell anemia. Okay, so what is the pathogenesis at the 6th? Very important, many people confused with this statement. Remember this statement plays a very important role in your concept building of the sickle cell anemia, so don't get confused. 6th cell in beta-globin chain, where don't get confused, glutamate or glutamic acid is replaced by what? Valine, right? What happens in 6th beta chain? Glutamic acid will be replaced by valine. Okay, don't get confused, this is the very important point. If you build a wrong basics, then whole building will be collapsed. Okay, we'll continue. What kind of change? It is point mutation, right? Point mutation. So what happens if point mutation happens here? Then we have increased hemoglobin polymerization. So what? If something is increasing, so what? It has solubility defect. Yeah, which is this gene, right? So let's make a normal RBC. Yeah, it's a dumbbell. We have hemoglobin here, where it is a normal RBC, right? Yeah, I ignore my dumb diagrams. I hope still it helps, right? Yeah, then normal hemoglobin we are talking about, where we have HbA, which will be replaced by HbS, which causes solubility decrease, where solid clump like structures inside RBC are formed. So this was our normal RBC, right? So what happens here? Shape doesn't change, like spherocytosis, shape will be remaining same, but hemoglobin clumps like this. Yeah, 3D specs you remember, right? This is hemoglobin clump. So if it is clumping, what happens? So usually here solubility will be high, What happens here? Solubility. What happens? It reduces, right? It reduced. So हो गया, कुछ हो गया. So what? That is the important. So what? रुको भैया अभी बताता हूँ. So what happens is there will be a membrane damage, and this membrane damage causes two types. Leads to two types, not causes two types. So we have reversible sickle, reversible sickling, then irreversible sickling. We got two pathways here. Then what happens? Let's see irreversible. अब तो नहीं होगा भाई, कितना झेलो करके बोलते हैं, like RBC is not anymore. Sorry bro, I can't help anymore. Then okay, then someone is waiting for their ice cream, right? We have our spleen. Then what happens? As usual, the same story, extravascular hemolysis. And coming to reversible, yeah, it becomes irregular membrane. It's like a beach. It's a membrane. Then what happens? Another one sticks, and this goes on. This sticky feature goes on. So irregular membrane ridges are formed. Then what happens? It becomes sticky. Then what happens? Obstruct vessels. Yeah, there is a problem. Irregular, it's like decent boy, it doesn't cause much problem, but reversible guy is horrible. He's like, हम तो जाएंगे, हम तुम्हें लेके ही जाएंगे. Vaso occlusive crisis, very important, right? So we have the pathogenesis. So okay, for second years, write this as a pathogenesis. Okay, hope your pathogenesis is clear. Then symptoms, which is like clinical features. If we have vaso-occlusive crisis, then what patients will show? Most commonly dactylitis, pain in finger. Then what we have, another one, chronic non-healing leg ulcers. Then what we have, priapism, acute chest syndrome, very important, where here we see like it's almost like MI, where symptoms will be like the patient will complain with a chest pain, sweating, plus breathlessness. So first thing, you have to rule out MI. It is an emergency, right? You have to rule out MI. Why this happens? Because clogging in pulmonary capillaries. So what next? Something happened, you have to treat it, right? It's emergency. So we give 100% oxygenation. In sickle cell, what happens? Solubility reduced, oxygen saturation drops, so you have to give 100% oxygenation. Then we give hydroxyurea, where HbF, it's a type of hemoglobin, where it reduces sickling. HbF mainly seen in which patient, physiologically where we see HbF? Yeah, that's right. So we see this in children's. For this, go and see my physiology video. oxygen dissociation curve. Okay, in physio section. Then what we have, what next? Then other symptom, initially it shows splenomegaly, but later we require only final thing, what happens at the end of the thing. So later what happens, tiny infarcts in spleen. By spleen is not a special organ, right? Even spleen gets affected. So what happens, spleen is fed up of its ice cream, so it closes door for ice cream shop. No, I can't eat anything more, bro, let me give a break for it. So when your spleen is compromised and there you get a concept or a MCQ or a 3 marker in the peripheral smear, you see what you see. Anyone, yes, that is your Howell gel body. Yes, that is important, right? Okay, I hope this is clear why it happens, autosplenectomy, right? Then coming to your peripheral smear, what happens, sickling of cell seconds, right? Sickle cells, these are also called as drepanocytes. What they call, drepanocytes. How cells will look like, your sickle that farmers use, right? This one, yeah, it is similar to this, right? Sickle cell. Yeah, this is sickling of cells where you see sickle cells. So we have screening test, for sickling, which is called as sickling test. Patient's blood sample, या खून निकालेंगे भाई हम डॉक्टर है. Patient sample with sodium metabisulfite, right? और sodium dithionite, कोई एक ले लो भाई, दो नहीं. Sodium metabisulfite or sodium dithionite. What happens when you mix? Yeah, you know the name, right? It's a sickling cell test. So sickled RBC we'll see. So you found the result. So what is the advantage of this or disadvantage of this? So mainly we will focus on disadvantage. कितना भी अच्छा काम करो, if you do one small thing you will be rejected, right? So what is the disadvantage of this test? It may be carrier or it may be disease. We won't find the difference. It will be positive in both. Sickling test will be positive in carriers or deceased person. So there comes, we can't leave, okay, you are a carrier or you are a deceased person. We can't say the deceased person, we have to treat him immediately. So best, we have another best test, investigation of choice. I mean, you can say it as not an investigation of choice, you can say it as better test. We have something else for investigation of choice, we have a better test called hemoglobin electrophoresis. It will find out type of hemoglobin, okay, where we'll get the accurate whether he is a carrier or deceased. So here comes our investigation of choice for the namesake. For all Hemoglobinopathy is not only this, even including your another one, which is that thalassemia, right? HPLC. Okay, what is this HPLC? High performance liquid chromatography. Yeah, इतना लंबा नाम तो कोई याद नहीं रखता. Just remember HPLC, right? I hope that will be easier. So here what happens? We will find type of hemoglobin plus ये तो हम normally better test भी find कर सकते थे. What else? We have to differentiate it between quantity and quality, right? So we will find out quantity of hemoglobin, right? Yeah. Then what next? So you found out, you did so many investigations, and patient is like, what doctor? So what next? So there is only one next. What is that? Treatment. Patient is expecting treatment, right? You have to treat it. So let's treat him. I said you'll give in acute chest syndrome that hydroxyurea. Then you will give L-glutamine. Since it was replaced, you have to replace. Then what else? So something is happening in your blood, right? So you have to transfuse blood, immediate blood transfusion, so that it will suppress your bone marrow, which was the main reason leading to production of sickle cell, which leads to reducing sickle cell. Yeah, I hope that is clear. Yeah, let's quickly revise. Today in this video we learned a very important topic, which is a qualitative hemoglobinopathy, so which is sickle cell anemia, right? Very important topic, you need to learn. So what is the sixth position? Beta globin chain only. What happened? Glutamic acid is replaced by valine. Then what it is? Point mutation. We have increased hemoglobin polymerization, where it leads to solubility defect, so it leads to hemoglobin sickle cell. Then normal hemoglobin, which will be leading to hemoglobin carrier, then diseased, then solubility reduced, clump will be seen, where the normal RBC looks like this, but it looks like this, then due to hemoglobin clumps, which leads to solubility reduced. So what happens if clump happens? Then membrane will be damaged. So we have two pathways. Then it will be irreversibly sickled, where spleen, as usual, ice cream, then extravascular hemolysis. Then coming to reversible sickled, we have irregular membrane ridges, which like this, like it leads to sticky, which leads to obstructive vessel, which leads to vaso-occlusive crisis, and this leads to symptoms where dactylitis, chronic non-healing leg ulcers, priapism, then acute chest syndrome, where we learned it mimics MI, like producing chest pain, sweating, then breathlessness. Then why it is so leading to such symptoms like clogging in a pulmonary capillaries. So what is the treatment? 100% oxygenation, hydroxyurea. Where mechanism, what is it? Yeah, that HbF, fetal hemoglobin, which reduces sickling, right? Then initially it will be splenomegaly, then later a tiny influx in spleen, which leads to autosplenectomy. If autosplenectomy happens, then spleen will be compromised, which leads to a very important finding in our peripheral smear, Havel-Jolly body. Havel-Jolly body, not, it's a Havel-Jolly body. Then on peripheral smear we see this one, Havel-Jolly bodies. Then other what we'll see, sickle cells, right? Derpanocytes, we call it as a derpanocytes, sickle cell like this. Then we have screening test what? Sickling test, patient's blood, sodium metabisulfate or sodium dithionite, which leads to a sickling of RBC, where disadvantage of this test is we don't understand whether it is a carrier or diseased. Sickling test positive, so we have better test called hemoglobin electrophoresis, which says types of hemoglobin. And we have investigation of choice for all hemoglobinopathies, that is HPLC, full form is high performance liquid chromatography, which basically says your type of hemoglobin and quantity of hemoglobin. So at last, treatment, we have hydroxyurea, which I discussed in detail under the section acute chest syndrome. Then we need to give L-glutamine because it is deficient, so we have to replace it. Then immediate blood transfusion just to suppress bone marrow so that it won't produce more sickle cells, right? I hope you understood the video. Make a proper notes of this topic because it is very important, and don't forget to, yeah, only thing I expect from you people, that is subscribe. Yeah, we'll find in next video. Thank you.